Hi everyone, welcome to the Dental Zone. Today I am discussing here about the bone pathology. Besides Paget's disease, which other condition may cause Leontiasis ossea? First of all, we know what is Leontiasis ossea. Leontiasis means line-like face. Line-like face means the condition where the bone anomaly grows and the appearance of face looks like a lion. And apart from Paget's disease, there are other many conditions where the face looks like lion. So one by one here we discuss about the Leontiasis ossea condition in other disease apart from Paget's disease. Paget's disease is very important topic. It is the second most common disease after osteoporosis. So Paget's disease we will discuss later, and now we are coming on the topic which condition that follow the Leontiasis ossea. So these are the names that follow the Leontiasis ossea: craniofacial fibrous dysplasia, gigantism, craniosynostosis, tumors of the paranasal sinuses, syphilitic osteoperiostitis, renal osteodystrophy, and uremia with secondary hyperparathyroidism. These all are the conditions where Leontiasis ossea found and the patient's face look like a lion. Here we can discuss a smaller brief about Paget's disease of bone, commonly known as Paget's disease or historically osteitis deformans. It is a condition involving cellular remodeling and deformity of one or more bones. It is characterized by abnormal anarchic resorption and deposition of bone. Abnormal anarchic resorption and deposition of bone means there is no controlling rule how the bone is resolved and how the bone is formed and what would be the ratio. There is no controlling rule here. So it primarily affect the older age group, and rarely it is found less than 40 years of age. The frequency increases with the age, and jaw involvement is present in 17% of the cases with a predilection for the maxilla. Here we can see that in the maxillary disease produces enlargement of the middle third of face, and it may result in nasal obstruction, enlarged turbinates, obliterate sinuses, and deviated septum. So and the patient face look like Leontiasis ossea or line-like faces. Other condition where Leontiasis ossea found, that is fibrous dysplasia. It is a disorder where normal bone and marrow is replaced with fibrous tissue, resulting in formation of bone that is weak and prone to expansion. As a result, most complication results from fracture, deformity, functional impairment. Basically, it is a developmental tumor-like condition characterized by replacement of normal bone by proliferation of cellular fibrous connective tissue with irregular bony trabeculae. The etiology of the disease: because the mutation occurs in GNAS gene. Mutation in this gene is responsible for fibrous dysplasia. But when the GNAS mutation occurs in early embryonic development, means mutation occurs in pluripotent stem cells, and this cause abnormalities in multiple cell types including osteoblast, melanocytes, and endocrine cells. So if mutation occurs early phases, these three changes are occurs in these three types of cells. Or if The mutation occurs in skeletal progenitor cells in a later stage of embryonic development. Later stage of embryonic development means the changes occur only in the osteoblast. Here we can see that Leontiasis ossea in the figure, and the line-like facies is visible here, and there is an extensive involvement of the maxilla and skull. So this is the Leontiasis ossea in case of fibrous dysplasia, and craniofacial form of the fibrous dysplasia is mostly involving the condition, and that is cause Leontiasis facia, craniofacial forms of fibrous dysplasia. Apart from these two diseases, other condition where Leontiasis ossea finds, that condition is known as gigantism. In this condition, there is overproduction of growth hormone in childhood and resulting in 7 to 8 feet taller person. So this is the condition where the overproduction of the growth hormone. It is a rare disorder resulting from increased level of growth hormone before the fusion of the growth plate, which usually occurs at some point soon after puberty. This increase is most often due to abnormal tumor growth on the pituitary gland. Means the increased level of growth hormone before the fusion of the growth plate. This is very important. Gigantism should not be confused with acromegaly, the adult form of the disorder characterized by somatic enlargement, specifically in the extremities and faces. This condition is different from gigantism. Now here we discuss about the acromegaly. In that condition also Leontiasis ossea occurs. Acromegaly is the disorder that results from excess growth hormone after the growth plates have closed. The initial symptoms is typically enlargement of the hands and feet. There may also be an enlargement of the forehead, jaw and nose. Mind it, here the growth hormone excess after the growth plate have closed, so that it occurs only in extremities. We can compare here the unaffected side of the person's hand, and here the affected side, which enlarges the fingers that are widened, thickened and stubby, and thicker soft tissue. And in other picture we can see that mandibular overgrowth leads to prognathism. Mandibular overgrowth leads to prognathism. Maxillary widening, teeth spacing and malocclusion is the classic feature. These are the teeth spacing where this type of malocclusion is a classic feature of the acromegaly. Now there is brow ridge and forehead protrusion remaining after tumor removal and tissue swelling eliminated. This is brow ridge forehead protrusion. The other condition where Leontiasis ossea occurs, that is craniosynostosis, is a condition in which one or more of the fibrous suture in an infant skull prematurely fuses by turning into bone, thereby changing the growth pattern of the skull. So craniosynostosis, where the fusion occurs and premature closure of the lambdoid suture, and this is the lambdoid suture where premature fusion occurs in case of craniosynostosis, and it may lead to the Leontiasis ossea. And the last one, here we discussing about the renal osteodystrophy, and this disease also follow the Leontiasis ossea like phase. Renal osteodystrophy has been classically described to be the result of hyperparathyroidism secondary to hyperphosphatemia combined with hypocalcemia, both of which are due to decreased excretion of phosphate by the damaged kidney. Low activated vitamin D3 level are a result of the damaged kidney inability to convert vitamin D3 into its active form calcitriol and result in further hypocalcemia. So high level of fibroblast growth factor 23 seem now to be the most important cause of decreased calcitriol level in chronic kidney disease patients. Now here we mind it that damaged kidney inability to convert vitamin D3 into its active form calcitriol and result in further hypocalcemia. So high level of fibroblast growth factor seem now to be the most important cause of decreased calcitriol level in chronic kidney disease patient. Now we can see that there is ground glass appearance of the skull. Ground glass appearance of the skull means a powder sprinkle on the glass and that appearance looks like ground glass appearance. This is all about the Leontiasis ossea, where these diseases follow this condition, and these are the references. Thank you very much to watching this topic. Please subscribe my channel if you like my video. Thank you very much.